Well, welcome. Welcome to CSR Talent Group's Innovative Insights. These are brief conversations that we have designed to showcase the unique talent that we have in our network, made up of CSR, ESG, and sustainability experts whom work as consultants, as fractional placements, and or as executive hires. I'm Sheila. I'm the head of partnerships here at CSR Talent Group. And we've invited one of our esteemed consultants, Julie Cornell of JAC Partnerships, to join us today because of her unique insights into the healthcare space. Julie has worked in healthcare for a combined 15 years across her career, including nearly her last engagement was nearly 10 years at Johnson & Johnson as a senior lead on their global community impact team. And she holds, and we've talked at length about her notable track record of designing, dispatching, or I guess delivering, communicating, and then ultimately evaluating, many evidence-based programs that connect communities to healthcare. And while we know that every variety of company grapples with things like what is impact and how do we measure it, lasting impact and how do we measure it, given the climate and in particular around healthcare companies these days and the demands from every variety of stakeholder, we were really excited to invite Julie here today just to give her perspective, again, from kind of her insider knowledge, having worked in the space for such a long period of time. So we'll jump right away into questions. First, Julie, tell us a little bit about yourself, right? And tell us what makes your experience unique and interesting. Your career is interesting to you.
Thank you, Sheila, for having me, and thanks to CSR Talent Group for the opportunity to have this really important conversation. So I like to say that I'm not a doctor, a nurse, or a midwife, but I've always been attracted to healthcare because I believe that access to quality of care is a human right. And I believe that people, policies, power, partnerships are what's needed to solve systemic issues in healthcare delivery and access. So I've committed my professional life to social impact, corporate philanthropy, communications, and community engagement across the healthcare and life sciences sectors. I have experience bringing pharmaceutical products to market, increasing access to care by working with grassroots health and community organizations, and advancing health equity and healthcare provider education with professional societies, health systems, academia, UN agencies, and the WHO as well. In my personal and community life, I'm part of an online charity fitness program that raises money for the environment and medical research. I also lead my town's sustainability council here in New Jersey. And then I also teach group fitness on weekends. So I'm really steeped in advancing health and well-being for everyone and to help ensure that the organizations working in those spaces can work effectively and can also work effectively together.
Neat. I want to come to your town. So actually, this next question is a little bit of a three-part question. So, kind of looking broadly, for healthcare, what can and should healthcare companies be doing? What is their role as corporate citizens in your mind? And then related, what are some of the more unique kind of innovative examples of, high impact approaches that you've seen as part of your career?
Sure. So businesses have an impact on the environments in which they operate, and not just the physical environment, but the systems, the organizations, the people who encounter the products or services that they make at various points in the value chain. And I think businesses' role as corporate citizens is to consider the impact that they have on that operating environment, or they could have, and intervene at the intersection of what's good for business and what's good for the operating environment. So I'll talk a little bit more about that from a healthcare context. So healthcare companies need to pay attention to the systems and the people who work with their products and services, from the supply chain to the healthcare providers and the patients who are going to be using those products and services. The operating environment for healthcare in the United States is very complicated and complex right now. We're dealing with an aging population with complex health issues. We're looking at health inequities in terms of access to and quality of care. We're looking at healthcare provider shortages in multiple types of geographies, especially with nurses as well as healthcare providers of color. So, where and how should a healthcare company intervene in that context? So, in my case, we launched and implemented a 5-year strategy from 2020 through 2025 to attract and strengthen a diverse and thriving US nursing workforce. We looked at partnering with key organizations across healthcare professional societies, at health systems, and at academia, and designed programs that were aimed at addressing kind of the key challenges that we were hearing from health systems leaders, from nurses themselves, from academic leaders in this space about um, around leadership development and professional advancement, and this idea that nurses are often undervalued and underpaid and not acknowledged for the work that they do. And they also have a right to have a pathway, a professional advancement pathway. And there's also some skills that they're not necessarily being taught systematically in their baccalaureate curriculum that are necessary for the realities of healthcare.
Mm-hmm.
So looking at that big sort of ecosystem of issues, right? We figured out, where can we as a company with limited resources, but with the cachet to establish partnerships with key organizations where we can really implement programs that make a difference.
Mm-hmm.
So we designed and delivered programs that provided leadership training and professional advancement to bedside nurses. We addressed training gaps for nursing students, and we also helped to diversify the nursing workforce at multiple levels. And we partnered with experts in the field and the people with the lived experience to really ensure that our programs were being informed by and kind of steeped in the current realities of healthcare.
Mm-hmm. Mm-hmm.
Um, and I think what made these programs high impact, because one might think a large pharmaceutical company has sort of very endless pockets, if you will. But the reality is that the resources were limited. So we
Mm-hmm.
had to design these programs to be scalable and to have a lasting impact. So we piloted and scaled new leadership and resilience curriculum at the baccalaureate level with 10 nursing schools.
Mm-hmm.
And then our partner scaled that curriculum to nursing schools across the country. So we had a limited intervention, limited cost over a 2-year period that then has an impact on the rest of the schools across the country that does not require additional investment from
Mm-hmm.
us. As a second example, we designed and scaled a nurse leadership development program and then a clinical ladder program, which is a systematic but customizable way for health systems to train and promote clinical nurses.
Mm-hmm.
So it's actually a succession planning in many ways for the health system.
Right.
And so you might be asking, well, how do these programs help the business? And of course, they don't help the business directly because it's not promoting a product or a service, but you're ensuring that the environment in which the business operates is strong and healthy and functioning.
Mm-hmm.
And that is a prerequisite
Mm-hmm.
for you to then be providing your products and services.
Mm-hmm. Mm-hmm. Makes a ton of sense. I think with COVID and of course the nursing, right? You hit that
Yeah.
Timely.
Yes.
As
Yes.
timely as
For
possible. Yeah.
sure. For
Yeah.
sure. And, some of the things that we were learning and doing in COVID, it was sort of wonderful because in health systems are still many of them are still very hierarchical.
Mhm.
And due to COVID, that hierarchy flattened
Mhm.
in many ways because it was all hands on deck. We're all smart, trained people who need to both work together, but also be empowered with
Mhm.
decision-making authority and autonomy. So we actually went out with one of our partners to mine some of those key insights in nurses that were leading telemetry departments and
Mm.
nurses that were looking at um, creating partnerships between the acute and the subacute care to more appropriately transition the right patients at the right time because
Mm.
you needed beds,
Right, right,
in
right.
the hospital,
Yeah.
but you also needed the subacute facilities to be prepared for the types of patients that they were getting.
Yeah. Yeah.
So we did a lot of mining of that data and turned it into thought leadership pieces because again, it's not just about how do we do good in that one space, in
Mhm.
that with that one program in that those handful of health
Mhm.
systems, but how do
Mhm.
we take learnings that can then be applied, obviously customized, contextualized,
Yes, yes.
ultimately applied to other places.
So interesting. So good segue to the next question, which is, I mean, you have been in this space for some time. I'm sure you've come across some pretty formidable challenges. And I would just be curious, like, what are some of the kind of, in your experience, again, some of the challenges that you have faced in executing some of the work that you've been trying to achieve? And then related, imagining that someone on this call, is now in your one's shoes at J&J, a director, a leader trying to
Hmm.
overcome some of these types of challenges that might be pretty typical. Can you name a few of those and how you might advise this person to
How to advise myself from 10 years ago. So I think you can look at the challenges. You have external challenges, and then especially when you're in a large global company, you have internal challenges as well, challenges and opportunities. So for the external challenges, health systems are complex operating environments facing really tremendous challenges. And there's a lot that's out of our control. So I think a lot of it is the humility to say there are things that are simply not under our purview and we kind of have no business intervening in some of those areas. Also the humility to learn from those environments and listen and see where you do have those openings. And then our partners also have competing priorities based on their member interest and demand. We worked with a lot of healthcare professional societies that are representing different types of healthcare providers. Often those groups are in competition with each other because
Mhm,
of
mhm.
limited dollars, limited share of voice. Um, they don't always want to work together, even though working together would actually make the intervention, stronger. So I think the challenge is finding the right areas of intervention and then the partners who share your vision, your goals, your objectives, and that
Mhm,
are willing to co-design with you and work as a team.
mhm,
So that partnership between, external nonprofit organization or a healthcare professional society and industry,
mhm.
being able to work together and it's almost in some ways being a little bit of an HR professional and kind of saying, who are the right people from our team that need to be involved in a certain intervention or program? And who
Mhm,
are the right people from the partners team that
mhm, mhm.
need to be involved? Because this is a, you know, different brains representing different
Sure.
specialties need to come to the table.
Yeah.
And
Sounds like you're also referencing the, like, kind of readiness, right? Meaning
yes.
finding partners who are ready and can have a shared value and
Yes.
ready to move forward, right?
Yes.
Yeah.
And exactly the next point that I'm about to make is also the environment in which your programs are going to be deployed.
Mm-hmm.
So if programs are going to be deployed in the baccalaureate environment, for example,
Mm-hmm.
who
Mm-hmm.
needs to be involved, who needs to sign off,
Mm-hmm.
what are the what are the different political factors, the different leadership stakeholders that need to be involved? Is there coaching that's necessary for your faculty if you're teaching new skills?
Mm-hmm. Mm-hmm.
Faculty don't necessarily have those skills to then transfer them to the students.
Sure.
If you're looking at a health system, which is even more complex, are nurses paid for their training time or are they not paid for their training time? Are
Mm-hmm.
they, does their chief nursing officer have to be involved or their chief educating officer? Who
Mm-hmm.
else
Mm-hmm.
needs to be involved or informed or sign off?
Right.
So it's
Right.
understanding what that enabling environment is as well. And then sometimes the internal challenges makes the external challenges look like they're easy to solve, even though they're not. Large organization, lots of different internal politics. Some of the struggles that we had, frankly, were, your budgets can shift year to year. They rarely go up. Mostly they stay stable, but sometimes they go down. There can be strategic shifts based on new executive leadership and, then differing opinions on what it means to support and be responsible to your operating environment.
Mm-hmm.
This is not, it's not an exact science. It is subjective. It is an art and a science. And there's different interpretations of what it means to sort of be responsible.
Mm-hmm.
And our team was getting a little bit caught in the middle of our executives were putting pressure on us to demonstrate how our work provides value to the business.
Mm-hmm.
And then our very well-intended healthcare compliance folks are saying, no, please, please don't even suggest that you create that kind of value. We all want to remain compliant. That was always the first thing I would say to my wonderful compliance colleagues is I'm here with you to be compliant, in policy, on paper, and optically as well. But we need to be able to articulate the kind of value that we're providing and the impact we're having because it is valuable. This
Mm-hmm.
work
Mm-hmm.
is really valuable. If you're looking at addressing the nursing shortage in the US, that's valuable
Yeah.
to all patients, regardless of whether they're your patients or your customers. That's valuable to all health systems, whether they're your health systems customers or not.
Mm-hmm. Mm-hmm.
So it's that being able to have demonstrate that you're having an impact on the healthcare sector in a different swim lane that is separate from selling products.
Got it. Got it. Totally.
Yeah.
Well, which leads us to our last question, which is, this idea of measurement, right? We know there's a whole variety of ways in which people or organizations, companies, nonprofits, internal teams think about measurement.
Hmm.
And in the case of healthcare, I guess, with J&J or otherwise, how do you see the best lane for measuring success?
And certainly that's always the sticky wicket, as a colleague of mine would always used to say in this space, is it is a social science. You often are measuring the outcomes of the programs you're supporting, which those outcomes can include things like an increased rate of promotion of bedside nurses into management positions. That's a critical success factor for a health system
Mm-hmm.
that's involved in your program. An
Mm-hmm.
increased rate of nurse retention, again, saving a health system money.
Mm-hmm.
Increasing the adoption of new curriculum across nursing schools nationwide, increasing the certification of nurses and midwives of color. So these are programmatic outcomes
Mm-hmm.
that we've seen. Demonstrating how that provides value to the business is difficult because it's reputational value, right? It's a halo effect on your business.
Mm-hmm.
I think the next phase of this work will be how do you turn that into something that is either monetized or quantifiable in another way? Because I've seen the use of reputation scores, and it's not an exact science. It's
Mm-hmm.
it's really not.
Mm-hmm.
And the impact of these types of programs on your corporate reputation is, again, that's very difficult to measure.
Right. Right.
Uh,
Sense.
and look at what is the impact on the target audience, the people who are participating in these programs, the system that's involved in these programs, and then how does that affect the business, up or down?
Mm-hmm. Mm-hmm.
It's not profit and loss, but it's the enabling environment for your business to be operating well.
Mm-hmm. Mm-hmm. Makes a ton of sense, and obviously very bespoke, as you said, depending on the company and
Of course.
the mandates and the beginning programming, obviously,
Of course.
the genesis. Well, listen, I could talk for hours, but I just want to thank you so much for coming on, and so interesting, of course, to learn about the icon J&J, and also kind of your enthusiasm and energy behind this work. Clearly, you know, you're an asset to CSR Talent Group and to any client, of course, that decides to engage with you. So, sincere thanks. And for the listening audience, if you're interested in learning more about Julie and how CSR Talent Group can meet your needs, whether, CSR, ESG, sustainability, expertise, we're here. So please feel free to reach out anytime. Thanks again, and we'll see you next time.